I'm Dr. Angela Servis. I'm the owner of Eden Clinic, and joining me today is Professor Jo Neill, who's a distinguished expert in psychopharmacology, and he's been at the forefront of research into the therapeutic potential of psychedelic substances in treating mental health conditions such as addiction, resistant depression, post-traumatic stress disorder, and much more. Over a very long period, there's been a growing body of evidence supporting the use of psychoactive substances like psilocybin, ketamine, MDMA, and ayahuasca in support of mental health conditions. However, despite their promising results, many of these compounds remain classified as Schedule 1 drugs, making research and accessibility incredibly challenging. In this interview, we're going to discuss the scientific evidence supporting these compounds, their safety profiles, and also the barriers imposed by the development of useful medications by the drug schedule status. We're also going to explore the historical reasons behind their classifications and how this impacts the ability to conduct the much needed research. So, Jo, can you sort of talk us through your early career in psychopharmacology, working in the field of drug discovery, and sort of how you ended up getting into the path of studying psychedelics? Tell us a little bit about you.
Yeah, thank you so much, Angela. I'm absolutely delighted to be on this podcast. Thank you for having me. And I should say to your listeners that I have been working on psychedelics for probably 5 or 6 years. So actually, I've come late to this field, and I think your listeners will understand why in a minute. So yes, I've worked in drug discovery for 40 years. So I actually started out doing a year. Well, I did a pharmacology degree at Bath Uni. Actually, I grew up in Northern Ireland, in Belfast, in the middle of the Troubles, which I think has had an impact on what I've done with my career, potentially. Certainly now, what I'm doing, working on trauma. I went to Bath University, did pharmacology, but always interested in brain and behavior. So, when something kind of goes wrong in the brain, then behavior is disturbed. And worked with pharma companies, but mainly in academia, 40 years, starting as part of my degree, working to develop better medicines for treating all sorts of psychiatric disorders. And this was through animal studies. So it was very early stage drug discovery. And there was quite a lot of sort of blue sky kind of trying to understand brain mechanisms in behavior. So I did that for a long, long time. And I kind of had a bit of a David Attenborough approach to studying animal behavior. So an ethological approach. So it's really understanding the natural behavior patterns of animals, and actually humans are, of course, just another species. And we use rats, mice, primates, some small primates, which I actually find very, very difficult, mainly because you have to sort of persuade primate. We just use marmosets, very small New World primate, but you have to be really patient to getting them to sort of come to their appointments and, do the task. Because I sort of specialized in cognitive tasks and complex cognitive tasks, and training rats to do a cognitive task is relatively straightforward. I mean, they're very, very, kind of the lab rats are very, very good natured. They're very, very smart, and they always turn up for their appointments. So they're really, really easy to work with.
Well behaved.
Very, extremely well behaved. And actually, listeners, I used female rats, certainly for the last probably 25 years of running a lab, and actually ran a contract research organization. So we were testing lots of different new medicines for pharmaceutical companies and biotechs and other academics. It was really rewarding, trained many PhDs, postdocs, helped to develop new animal tests. We had a good model of cognitive dysfunction, sort of subtle dysfunction in the animals. And the CRO, it's called B Neuro. It's still going now, but I quit about 6 years ago, because in all that time, and I'd worked on the disorder I wanted to work on always was addiction. But could never get any funding for it. And actually lots of my funding came from pharmaceutical companies. Listeners, I tell you, I couldn't get an MRC grant to save my life. It's so, so difficult.
Yeah.
I worked at Bradford University for many, many years. And actually, we had a great history of working with industry. And Bradford University had the biggest spin out of any UK university in the East. So I learned a lot from my boss, actually, about sort of how to work with the industry, and worked with some brilliant scientists. So wanted to work on addiction, couldn't because couldn't get the funding, worked on depression, anxiety, panic disorder, and latterly more schizophrenia and other cognitive disorders, severe depression. But it was always about trying to improve function, and then trying to investigate what that medicine was doing. Anyway, to cut a long story short, in all that time, we worked on some such clever projects, but nothing, folks, ever got into patients that made a big difference to their quality of life. A couple of Me Too drugs we worked on. I also worked on ADHD, which was a lot of fun, very interesting. But I kind of, lots of them, there are issues with the animal studies and with the whole sort of progression of phase 2, phase 3, these big clinical trials. And most of them either failed in phase 2 or failed in phase 3. So I really lost my faith in randomized controlled trials, in the very strict one outcome measure. And if the study or the trial did not meet the criterion, then the drug didn't work for that particular outcome measure. Everything was scrapped. And a phase 3 trial can cost up, close to $1 billion. I mean, it's just such a lot of work and money. And actually, in psychiatry, then the situation is that the drugs that we are prescribing now really are not that much of an advancement from the drugs that were discovered serendipitously in the 90s. The first antidepressant,
Really?
first antipsychotic, mood stabilizer, the first anti-anxiety, Valium. So really, compared to other disciplines like cardiovascular, cancer, surgery, psychiatry has really not advanced. The technology has advanced, imaging
Yeah.
and some very good, epigenetics. There's some fantastic work going on. But in terms of patient benefit, it's just not there. So what happened to me, I'm starting to get, I moved to Manchester University in 2013, and we have a policy unit, and I tell people moving from Bradford to going to Manchester was like playing for Accrington Stanley and then playing for Manchester United. It was so great. Such clever people, so much money swishing around, and fantastic facilities for research. So we have a social responsibility as our third core goal. And I got involved in an art exhibition for people with a diagnosis of schizophrenia. And that was, that sort of public engagement and reaching out to patients and trying to enable the public to understand, what it's like to have an illness like that was probably one of the most rewarding things I did. So I was getting really sick of the lab work, the failure of what we were doing to actually make a difference. So I was driving home from work one night and I heard Neil Woods talking on the radio. And listeners, I don't know if you've ever heard of him. If you ever get a chance to hear him speak, absolutely do that. So he's a former undercover cop who was working to take down organized crime who were involved in the drug market. And he was really successful, and he took out a load of top criminals, got them locked up. So his terrible trauma, he gave that up when he realized that actually the work that they're doing, the undercover work, the seizure of drugs, is doing an awful lot more harm. So your organized crime people become more paranoid, and they've weaponized the drug war and how much damage that is. And when he did a bust, the people that he sort of befriended, the people who were dealing drugs to fund their own habit, and we all know that addiction comes from trauma. And he's been campaigning since he gave that up to change drug laws and for state regulation of drugs. So I that really struck me, and I thought, why am I not working on this? Because this makes so much sense to me. The laws on for drugs are doing so much harm. Drug laws killing people, and we need so much more. We need a complete, drug policy shift. So there are, of course, a lot of really good people working in this area, and it's heartbreaking what's going on. So then I started to work with drug science and Dave Nutt. And of course, drug science is all evidence-based information about drugs for people. But they were getting very interested in psychedelic medicine. And I joined, and I took a sabbatical to learn about psychedelics. Actually, I met a combat veteran here, friend of my daughter's, who had been in Afghanistan, and he had become really, really unwell. And with PTSD, got a diagnosis, was offered CBT, but he'd have 3-month wait, was offered antidepressants, didn't want to take them. Took himself to Holland and did a couple of high doses of psilocybin truffles in a hotel room with his girlfriend, which kind of isn't really how you meant to do this. But he actually came out well. So, and what an amazing, I just talked to him for a couple of hours, and I thought, you know what, this is what I'm going to do with the rest of my career. I'm going to enable other people to access a medicine that works.
Yeah, and that's amazing, isn't it? And I think there's, psilocybin certainly is much more in sort of general conversation. More and more people are inquiring out about it and finding out about it. But, there are a lot of barriers. And obviously in the UK, it's certainly, there's no sort of legal approach for the use of it. Can you, that was a brilliant introduction, though. That was really, really fab to sort of hear your story and your journey into this. And also to hear about the role of funding and the role of politics within this journey. Actually, I think you can sit back and hope that this background in sort of development of medicines, that, the heart of this is all based in the right of the patient and getting the best medication. But actually, there's a lot. Drug development's expensive, and, it has to come from private, it always comes from private equity and things. And that in itself sort of changes that journey. But let's start talking about psilocybin. What's the current evidence about psilocybin in the use of addiction, PTSD, depression?
That's a really, really good question. Most of the clinical trials now are using psilocybin. Maybe we should go back. Well, the other thing I think about psychedelics is that they have been used by Indigenous people across the world. But, a lot of this going on in the Amazon, in South America, for healing and for spiritual purposes for thousands of years. There's really good evidence for this. And I think we need to be very careful in the West that we don't appropriate a medicine that actually belongs to Indigenous people, like ayahuasca, peyote, ibogaine. I think just we need to be very aware of where the medicine that we are trying to use to kind of cure or heal our ills caused, I suppose, by Western society, kind of where that came from. So that's kind of the start of the history. And then, and the other thing is these are plant medicines. And I think for many people, having a plant to heal you makes an awful lot of sense. Cannabis is a plant, cocoa is a plant, cacao, all that many Indigenous people will use, in their healing ceremonies. Loads of healing plants in the Amazon. But sort of a little bit more recently then, in 1938, Albert Hofmann, he's working for a big pharmaceutical company, Sandoz. He synthesizes LSD, and that's kind of his kind of use of it, or taking it himself and his experiences kind of really shaped the clinical research in the West, I think. But that's not... Ecstasy, of course, was synthesized, I think, in 1916. Somebody was working at Merck, and they were looking for a medicine for blood clotting disorders. And
like that,
synthesized ecstasy. Well, so it wasn't just magically synthesized, in the 60s. And most of it's really interesting. So the synthetic versions of these psychedelics did come from the pharmaceutical industry when they were looking for something, and LSD and ecstasy were not what they were they weren't what they were looking for. And actually ecstasy got shelved until Shulgin then was working for Merrill Dyer, I think it was, and picked it up again. Then it got started to used in clinical practice for couples counseling and so on. And of course LSD, Sandoz knew that this was going to be very, very important, but they didn't know what for. So they distributed it widely. It wasn't illegal in those days, to psychotherapists, psychiatrists, medics, and enabled them to do some clinical work with it and collect the data. So there was an awful lot of work done. Quite a lot of work done on the existential anxiety and depression in people with a terminal diagnosis or
Yeah.
like a cancer diagnosis. Quite a lot of work done on pain, and LSD outperformed morphine. Now what others? A lot of work done on addictions. So Humphrey Osmond famously treated 2,000 people with alcohol use disorder. Um, and he got a 40% abstinence rate, and Alcoholics Anonymous is 7. So, extraordinary. And of course, the founder of AA famously used acids. And of course, many of your listeners will be familiar with the Timothy Leary and the tune-in dropout and the counterculture revolution. Of course, Nixon didn't want that. We all know that psychedelics are very anti-aggression. They're very pro-social, pro-environment, pro-empathy, connection to other people, to nature. So he knew they weren't dangerous, but he managed to persuade the UN Convention to make them Class A drugs. That is
just phenomenal, isn't it? Because of the political climate at that time, the political type fight. So that was all based on sort of current warfare at the time. It's fascinating that decision there and then, with the knowledge of the safety of these medications, that was the drive for the sort of political sort of underlying decision and thought process there was bigger than that, and the fact that impact has continued for so long afterwards.
Oh, it's terrible, because the Misuse of Drugs Act was 1971.
Yeah.
All the drugs became illegal. They're either Schedule 1, which is no medical benefits. All psychedelics are in Schedule 1. We'll talk about that in a minute. And all the other drugs that that you could think of, ketamine, opiates, cocaine, amphetamine, they're all Schedule 2, which means that academics and clinicians don't need a special license to work with them. So anyway, but that
that. Yeah, I think part of that is interesting because, politically speaking, it takes a sort of a very strong voice to be able to say, knowing now the problems that there are with, the very visible problems that there are with drug use and the impact it has on not only on the individuals who are struggling with drug use, but obviously, crime rate and the public perception of drugs and drug users, people using drugs, is really challenging. So politically, standing up and saying, actually, let's legalize these or reduce their schedule, would take a bit of bravery and some really good communication and also some trust. Yeah, sorry, Jo, I stepped in there.
I think my impression, having talked to some MPs and being in Parliament, my impression is that there are a number of MPs, this is a cross-party issue, who would like to see the reform of our drug laws. You're right, it's a difficult subject, but I find that when you explain it to people, I mean, in the UK, Angela, not only do we have the highest rate of drug-related deaths in Europe, we are responsible for a third of all drug-related deaths. And 25 countries in Europe, that was 2019. I don't know, 3,000 people died of nitazene overdoses in the last 18 months. It's an epidemic, and the only, we cannot arrest our way out of this. The only way is to radically reform the drug laws, decriminalization. Why would you criminalize people for having a health issue? And the countries where they have done this, they don't have drug deaths.
Yeah, I mean, that speaks for itself, doesn't it? And yeah, like you say, it's criminalizing something that is quite clearly based on a health issue and is almost always based on some sort of traumatic history. It's looking at the child behind the adult a lot of the time, I think. And I think sometimes that's a lot more palatable to being understand things. But yeah, so I took you off on a slight sidetrack there, didn't I, Jo?
Yes, Angela, I didn't answer your question about psilocybin. So just to go back to that, the last time I looked on clinicaltrials.gov, there were, I think, over 400 clinical trials registered with, I mean, not all of them with psilocybin. There's quite a lot going on with LSD. Of course, the half-life of LSD is much longer than psilocybin. So psilocybin works really well in a clinical setting because it's probably in and out of the system within about 4 to 6 hours. So you don't have to keep somebody in overnight.
So,
And you know,
the psilocybin, it'd be good to do a bit of a deep dive into that. And actually, one of the things you just mentioned there, Jo, was the clinical setting. And obviously, just previously, we were talking about actually this is plant medicine, which has remained sacred to many people for thousands of years. And they include it in ritual and for spiritual reasons, as well as for health issues as well. Now, this is fascinating because circa the early 1900s, where we started separating science from the arts and separating philosophy in one direction and literature, language, poetry, the arts, in one direction, and then we put medicine all the way over here. Medicine has become something clinical that we do in clinical spaces. And we've very much separated out the spiritualism and that element of things with these plant medicines that have been so deeply entrenched in spiritualism for so many people around the world for so long. What impact, I suppose, does that have on the provision of those services if they were to sort of go into in a more clinical setting? Is setting important?
Setting is very, very important. We talk about set and setting. So, I mean, the other thing to say is that this is an incredibly profound, can be a very difficult experience for people. If you have a high dose of a psychedelic, you are pretty lots of the time going to have to face your demons and your trauma. And by doing so, that sort of enables the start of the healing process. And the way in which they work is absolutely extraordinary. So the setting, it is very absolutely essential to be in a safe space and to be held when you are having this really profound and difficult experience. And however that is, whether that is in a retreat center, or whether that is in a clinical setting, it is a difficult one because I was talking to Simon Ruffle, who's Onaya Science, actually, give a plug for his fantastic organization. So he is a British psychiatrist who has spent quite a lot of time with the Shipibo in South America, learning how to be a shaman. And he says that the shamans are absolutely horrified that in the West we don't have a shaman as part of the experience for people. And of course, in the West, we're kind of horrified that they don't have a medical doctor present in the retreats or in the, so it's the difference in the perspective, I think, is absolutely lovely. I think for some people it's the only way they're going to be able to access it in a clinical space. The problem we have is that, as I said, they're Class A drugs. They're illegal in this country. You're not going to be able to access psychedelic in this country legally without being part of a clinical trial. So for some people, it's the only way they're going to be able to access it. Not everyone has the luxury of being able to afford to go to South America or the Netherlands or Portugal or Spain or, countries where it's legal to have a psychedelic retreat experience. This is not a cheap thing to do. I guess, of course, for severe depression, ketamine is a licensed medicine and people can. But again, that's private clinics. There's only one NHS clinic that I know of for ketamine, and that's Rupert McShane in Oxford, and he doesn't take many people. He's absolutely fantastic, and it's been a very difficult and brave thing for him to do, to be delivering ketamine within the NHS setting. So, but it's really interesting, Angela, because it really does depend on who you talk to. And for many people, a clinical setting, although, the people delivering this, at Imperial College or at Exeter or at King's, within these clinical trials, they have absolutely made the room and the setting as peaceful and tranquil, full of, with plants and nice lighting. And the music, of course, is very, very important. And in the Indigenous communities, the shamans sing the Icaros, which is very, very much part of the whole process. Sounds actually amazing. So that, that for the people I've met who've had that clinical experience, it is a lovely experience. And I guess the clinicians are trying to make it as close as they can to, but of course, in a retreat or, if you go and have a shamanic experience, that will be in a group setting as well. And there's a little bit of clinical work in group settings. And I think that the cohesion and the bonding of people in a group setting when they all have an experience together, that's pretty extraordinary. And that's also part of the healing, I think, that peer support I hear quite a lot about that.
Yeah, and I think it's interesting actually. So people who often, I think a lot of people who experience substance addiction, substance misuse, and also trauma, and get to a stage where they might be reaching out to these things. One of the, I mean, certainly, I mean, Johan Hari puts it phenomenally well when he talks about the disconnection and isolation that you get with trauma and with substance misuse. And actually, I think that's one of the things that people do cite, isn't it? That feeling of love and connection, and that connection that people experience when they get that group work, when actually previously they've been feeling so isolated. And it's interesting to, I mean, I keep banging on about going back to the limitations and restrictions of the laws, but actually the isolation that further imposes on people, certainly with substance misuse, is compounding the problem. Whereas actually, the use of those psychedelics in group work, I think, done appropriately, can really foster that connection.
Absolutely. And Angela, it's absolutely disgraceful and heartbreaking when we have so much clinical information from pre-1971, post-1971. I mean, there are trials going on all over the world and centers like Johns Hopkins and Harvard as a center for psychedelic research. So many of these very prestigious places now. I think and we have a mental health crisis. The other thing I learned is that there is a report that's been coming out every year since the pandemic. I can't remember the name of the people who do it just for the minute. It's the Mental Health of the World report, and it's comparing 82 internet-enabled countries for many indicators of mental health. And the UK for the last 2 or 3 years has come last of all these countries. I mean, we have a mental health crisis. It's shocking. There is a medicine that can enable people, to heal from many disorders, and of course, addiction is one of those. I just think it's disgraceful that the sort of powers that be are not working harder to find a way forward. Compassionate access. We're working with people with a cancer diagnosis, and what a psychedelic experience does for those people. As you were saying, it's that connected. And actually, what I've learned about having a diagnosis like that is that's a very, very lonely experience as well. And we've done a small qualitative study with 7 women with a cancer diagnosis who have this existential anxiety crisis. It's a complete crisis. Oh my goodness, I'm going to die, far sooner than I sort of thought I was. And what the psychedelic experience does, it enables them to live every day well, and not to think, oh, my life's going to be shortened. It's just like, it's not about how long you live, it's how well you live, and how, the every day, and that connection. So the themes that came out of that were criminalizing nature, how horrified they were that they were made to feel like a criminal if they tried to talk about it and learn about it in this country, and find a way to access a psychedelic. Or they went abroad to do it, and then the sort of that criminalization in this country, they were absolutely horrified to learn about that. Then that absolute healing journey that it gave them, that experience. I was lecturing the Manchester students the other day on this, and had a wonderful cancer patient come in and talk about her experience. I'm not interested in illegal drugs at all, but had, because of the patient advocacy group that she was in, she had learned how beneficial a psychedelic could be for enabling. And she said, now I'm living every day. And I'm not thinking, about, the treatment and the death, or the cancer.
And that's a really fascinating example. That's a really fascinating example of a time in life where you don't have time to do talking therapies, but actually the process for those individuals, but also the process for their family members who are trying to support them, actually just seeing them in less emotional discomfort, and seeing, the process for all their loved ones around them will be better, seeing them more contented in that process in their final time. I mean, what a gift to be able to share from a palliative care point of view. With those individuals.
But we're forming a working group, and there is actually, what is heartening about this is that some of the funding. So there's a big EU grant, I think it's €6 million, to study or to do a trial of psilocybin for palliative care.
Oh,
But this
wow.
is not in cancer. This is COPD, is it? What the
Wow.
obstructive disorder
Yes.
and some
Yeah.
other pretty terminal disorders. So
Right.
that's heartening that the EU are funding these kinds of studies. And of course,
Yeah.
TheraPsil in Canada are enabling people to access psilocybin for end of life.
Yeah.
And that's through a legal process. They're working very hard. There's why in the UK would we not have compassionate access? Would we not enable people like people with the terminal, the assisted dying bill again is going to be debated this week or next week in Parliament. It's a really good opportunity to frame how we see our own death, how we treat people who have a terminal diagnosis,
Yeah.
how we enable them to make choices. And in Canada, they have the right to try. So you have the right to
Yeah.
try a psychedelic. As we know, it can give you a complete shift in your perspective of and your relationship with others and nature and so on.
Yeah.
So maybe you're not going to, it makes sense to try first before you decide whether you're going to terminate your life or not. So yeah, and it's very, very frustrating that there are mechanisms to enable people. I mean, people are enabled to have cancer medicines that haven't been through, full FDA or MHRA approval in this
Yeah.
country. Why can we not enable people in, distress? And I mean, people will say to me, oh, but they're really dangerous and they can completely, twist your mind. It can, well, so that's actually just not true. This is an altered
Yeah.
state of consciousness. Let's
Yeah.
not deny that it can be a very challenging experience for people and that Jules Evans actually is working on this. And there are some people who will have a very difficult experience. Most people who have a very difficult experience will come out the other side will come out much, much better. For many
Yeah.
people, it's a fantastic experience. It's a totally joyous experience. Physiologically, they're very, very safe. You couldn't
Yeah.
overdose, you can overdose pretty easily on most other, illegal drugs, opiates for sure. I mean, you can overdose
Yeah.
pretty
Yeah.
easily. Cocaine, ketamine, you can certainly take far too much ecstasy, but you couldn't with a psychedelic because of the mechanism of action. They're not going to stop you breathing or your heart or,
Can you talk
and the
through a bit?
paradigm. Well,
Could you talk us through?
yeah, but the paradigm. Sorry,
Sorry, Joe.
I've interrupted.
No, that's all right. Could you talk us through a little bit about the mechanism of action as well, Joe? Just a bit about how they work.
And what I love about the work going on now is that there's all this imaging work, there's epigenetics going on.
Yeah.
Um, there is a lot of really, really cool work to enable us to understand how they work. I mean, they work on the serotonin system. They work on the 5-HT2A receptor for people. That serotonin is a neurotransmitter in the brain, and all neurotransmitters like dopamine, noradrenaline, serotonin, they act on a specific protein in the cell membrane that causes a cascade of intracellular events that will bring about their ultimate effect. Of course, we know that serotonin has a big effect on appetite, on sleep, on mood, as many of the, dopamine as kind of the reward neurotransmitter, feel good, but has a lot of effects on movement, depending on where it is in the brain. So the thing about these receptors, and they're relatively specific for them, is that they're located in a kind of deep layer of the frontal cortex. And of course, this is where
Yeah.
a lot of the thinking goes on, the kind of the executive function, the decision making. And so they interact so they hit that receptor and then
Yeah.
they induce a cascade of events. And that involves glutamate. So you get some excitation in the brain, and the kind
Yeah.
of result is almost like a rewiring of the brain. So the brain, of course, is organized into circuits. What in disorders like severe depression or addiction, trauma, some of the circuits become kind of malformed and hyperactive amygdala, for example, places where you really don't want too much activity. And it's sort of, they talk about it like being a bit of like a vinyl record that gets into a bit of a groove. And what the psychedelics seem to be able to do is that they disrupt those dysfunctional connections. And that's kind of all through this
Yeah.
pharmacological interaction with glutamate and various other kind of processes in the brain. So they induce neuroplasticity through a direct interaction with the sort of brain-derived neurotrophic factor system that we have in the brain to produce new synaptic connections. And what we know now is that actually, I think that people thought that once the brain had developed and the circuits were all formed, there was not much you could do to change that. But actually, we know that that's wrong. And meditation and therapy, years of therapy, can, kind of enable new synaptic connections, can kind of change the circuitry, particularly maladaptive circuitry. Neurofeedback, there are some sort of brain stimulation, non-invasive brain stimulation techniques, and kind of your behavior, exercise, and then we can kind of switch genes on and off, epigenetics, and psychedelics do that. But the thing that I suppose the brilliant thing about psychedelics is that they do this with a couple of doses, high doses. So it's a complete paradigm shift in psychiatry. You prepare very carefully. You do the couple of high dose under very right setting, very careful supervision. And then you have some integrative therapy to make sense of that experience. Some people, this chap I talked to all those years ago, he's, as far as I know, not done psychedelics since. That was enough to kind of reset him. David Nutt says I like this. He says it's like the orchestra playing without the conductor, because it switches off the default mode network in the brain, and it enables kind of parts of the brain to communicate with each other that haven't done so since you were kind of a child, a developing individual. The science is absolutely fantastic, and the reason you don't have to take them again, maybe, or not for another, say, 6 months, is that because of this neuroplasticity. So those effects that they have are long lasting.
Which is just it's fascinating as well, though, isn't it, that we've got so many of these plants that have such a profound impact. And it's I mean, you drew on earlier your experience with your previous work, trying to develop drugs that were going to help with management of trauma and depression, mood issues and things. And yet here we have very readily available these plants that have such a profound and lasting positive impact, and relatively safely in a lot of their cases. And, I mean, we're talking about ibogaine as well, ayahuasca. Obviously, ibogaine, I think there have been some cardiac potentials that have been so it's slightly different, but again, it's this plant medicine that's coming, I believe, from Africa. Is that correct?
Well, iboga grows, I think, in Colombia. I think also grows in But I think you're right. There's a lot in Africa. Yeah.
But it's just fascinating that we can try and do what we can in labs, and yet sitting there happily in nature is actually something that can have such a positive and lasting impact on people.
Angela, how stupid do I feel? I've been working on these synthetic molecules for so many years, and actually the plant, they grow here, psilocybin mushroom. It's been in front of me all these years.
But but I mean, Joe, is like part of that. If you'd gone straight to psilocybin and these sort of psychoactive medications in nature, you wouldn't have known everything that you picked up before that. So, and the fact that you managed to it's really interesting when your journey changes so profoundly, the contrast is even clearer. And in the field that you've been working in, and the work that you're currently doing now, and even having these conversations with me, and hopefully some of our listeners will, I'm sure, agree that actually hearing that journey in itself has been really, really useful. So can you talk to us a little bit? Obviously, we talked about psilocybin. Could you talk to us a little bit about ayahuasca as well? Because that's another one that's become quite common in conversation.
Indeed, yes. Yeah. So ayahuasca comes from the Banisteriopsis vine, and the active ingredient is DMT, dimethyltryptamine. And actually, it's similar to psilocin, which is the active ingredient of psilocybin, in its structure, and it's very similar to serotonin. So it's no surprise that it fits really well into that serotonin receptor. So ayahuasca is this sort of brew that they make, and so it grows naturally in the jungle in the Amazon, and the Shipibo and many other indigenous people have been using this for, they brew it up. It occurs. So DMT is very, very short acting if you just take that. And in the clinical trials, they've given it intravenously, and it does get, because if you ingest DMT, it will just get metabolized really quickly. So you have to give it with a monoamine oxidase inhibitor to inhibit the enzyme that's going to and that's really interesting. That's going to metabolize it really quickly. And of course, indigenous people have known this for thousands of years. So they make the ayahuasca with I think grows together with the natural plant that is the inhibitor for the enzyme, and so they give this as a liquid.
How did they come across that? That's intriguing.
Well, no, I think for your listeners, I would read Fellowship of the River. That's a wonderful book about Joe Tafur, an American psychiatrist who went to live with the Shipibo people, learned to become a shaman. There's a bit in that about doing dietas. So the shamans live with the plants and have a plant diet, and sometimes for up to a year, and they kind of live a bit isolated from the other, from the other people in their town or the village, and so they spend a lot of time just connecting with the plants, and actually it's the plant that teaches the shamans about how to deliver the medicine to heal people. It is absolutely extraordinary, and I think it's something we in the West don't really understand. I have a lot of respect for those people who've gone out there and done a dieta, because you lose a lot of weight. You're just eating plantain, maybe plain rice. There's absolutely no flavor in what you're eating, and doing a lot of ayahuasca ceremonies. And ayahuasca is, of course, the psychedelic that makes it, it's the purging, and people can vomit or, diarrhea. Quite a lot. There can be quite a lot of sort of muscle activity, quite a lot of sort of shaking and stuff. And that's kind of releasing the trauma, because, Bessel van der Kolk, we do keep store trauma in our bodies. So that, and it's quite long acting. So they tend to do these ceremonies at night, and that they will be singing Icaros. And the Heroic Hearts Project UK that I work with, that's their remit, is to take the veterans to Peru to do ayahuasca, but it's essentially DMT. And that seems to be quite a different experience from psilocybin. And many people I've talked to who've been out there say they kind of meet the ayahuasca witch, or she will sort of come to you in visions and explain to you where you've gone wrong in your life, and what you need to do better and to change. Actually, I highly recommend people listen to Keith Abraham's podcast. I think it's on Psychedelics. That's a podcast that delved into the science of psychedelics. It's beautifully done. So he really explains his experience with the ayahuasca witch, and it's very profound, actually, and hard, really hard, because he said, like being back in the schoolroom, you're being, explained to how terrible your behavior has been in certain circumstances. It's but I also talked to a few veterans who've had horrible trauma, suicidal, and the whole experience with ayahuasca can be really, really challenging. I mean, one chap said he just felt like he'd been punched, or,
Yeah.
But
Could you tell us a bit about? You mentioned Heroic Hearts there, Jo. Sorry to cut in. You mentioned Heroic Hearts. Could you tell us a little bit about them?
Yeah, so I think this was a charity set up by Jesse Gould in the States to support combat veterans. So he had his own experience with a psychedelic. And actually, the chap I met here had learned about psilocybin therapy from Americans that he trained with. So the Americans, funny enough, started the war on drugs. Maybe they'll finish it. The veterans seem to have a lot of more knowledge about how to heal there and using psychedelic plant medicines. I suppose it's easier for them maybe to go to South America. So Jesse had his own experience, and he then, I think what happens, it's such a transformational experience that people think, well, if I was so unwell and I've healed, I want to be able to enable other people to heal. And I know, lots of the people they served with, They really feel that this is something that they need to be able to access. And of course, there's lots of work going on in Ukraine at the moment,
Yeah.
Gaza, other places where it's horrible, horrible conflict or
Yeah.
devastation. So he actually is very politically influential and has been responsible for changing the law on psychedelics in quite a few
Wow.
states in America. In
Yeah.
the States, is it 20 veterans a day kill themselves through suicide? Far more than ever died in any of their
Yeah.
wars. So, um,
There
and
was
that's
actually there was a good Joe Rogan chat actually about with a politician and another gentleman discussing the use of ibogaine in addiction, and also, but they did touch on trauma as well. Obviously they go hand in hand, and it was really refreshing to hearing about change. And because you can feel a bit trapped, and you think about the time frames that all of this has been going on over, and obviously the alteration of schedule in the UK. What was it, 2005? Am I right?
what, when they put psychedelics into Schedule 1? Well, I'm not sure, actually.
It
I
was
think maybe it was, actually. Yes,
It
yeah.
may
I
have
don't
been
know.
a bit of a shift for a pre-election campaign, I believe. But it was just really useful hearing a conversation with, a politician openly talking about it, actually having talked about
Yeah.
personal use in another country. And I think ibogaine certainly has a real it's a very different medication again, but it has a real basis for use in addiction again. There are changes happening all over. It sounds like there are really positive changes happening in Australia as well.
Yeah, legal in Australia.
Yeah, yeah, absolutely. I was on a talk with Professor David Nutt the other day. He was obviously incredibly happy. And as you say, there does seem to be shifting opinions. Canada obviously doing well with that, and in Europe as well, which is fantastic. And I suppose really it's the regulatory barriers of the Schedule 1 just makes it pain to really, really difficult to be able to research. But I suppose getting information out there about them and about their uses, because I think there's still a lot of reputational damage from the Nixon era, which is madness, I think, about how dangerous they are. And there was the whole, a Say No to Drugs campaign. Really interestingly, when you're looking at the drug science website and when you listen to David Nutt and a lot of his talks, he'll talk about the dangers, where the psychedelics sit when you compare the risk profile with psychedelics and the two things that are incredibly legal in the UK, just starting from the top, which is alcohol and tobacco. And they're far more, known to be far more dangerous than psychedelics, yet they're out there and taxed nicely.
Yep.
So it's interesting looking at the sort of the political sphere and how that's influencing these medications and their provision. However, the cogs seem to be slowly turning on the global front, and hopefully we'll pick up on these things in the UK. So
Well, I hope
what,
so. Yeah.
yeah, what do you hope to I suppose achieve in the therapeutic development of psychedelics in coming years? Not necessarily you personally, but what do you hope is achieved in that? And what do you think the important steps are in order to achieve that? Thinking specifically about the UK, what do you think are the big changes that need to happen in order to do that?
It's a really, really important question, Angela. I was at a regulatory roundtable hosted by a law professor in Birmingham last week, and some of the experts were there, and people who are actually working on clinical trials in the UK.
Oh, well.
MHRA approval will be, and when we ask Home Office to reschedule, they always say, well, we will once MHRA approve, which is frustrating because scheduling is disabling research. And
Yeah.
just for your listeners, it costs a lot of money to get a controlled drugs license. There are big delays with the Home Office. There's a lot of bureaucracy involved. You have to sort of change your lab around. The Home Office are understaffed for this. If you're trying to run a clinical trial, it's far worse than if you're trying to do some animal experiments. You need a controlled drugs license for everywhere that the drug is stored, every location. It really doesn't make much sense either when we are allowed to store quite safely Schedule 2 drugs without any special permission from the Home Office or any, ridiculous sort of regulations. So that has disabled research in the UK and in other countries, actually. It's really, really what we need is research exemptions like we have for Schedule 2 drugs. And Home Office are working on that, I know, and ACMD, and they have recommended that. So I'm frustrated that government won't do this because that's not going to affect anybody. It's just going to enable research. And if MHRA are saying we need more research, NICE will say we need more research. They need to enable research. We need more funding for the research as well. And meanwhile, people are dying and people cannot access, we've got horrible drug overdoses. Prisons are full of drugs. It's a crazy, terrible situation that we have here. Meanwhile, Australia has legalized ecstasy for the treatment of trauma, for PTSD, and psilocybin for severe depression. And it's no accident that David Nutt was in the country giving tours and lectures when they decided to do that. But this government sacked David Nutt because he wanted to downgrade ecstasy, and when he gave them some evidence, harms of other activities, riding, and the harms of alcohol are pretty well known. People die of alcohol poisoning, liver failure every day in this country. Compared to it's absolutely shocking, and it's sort of sanctions. That sort of cognitive dissonance is extraordinary. We are a very, very conservative country, clearly. But if a country or a continent like Australia can legalize, Portugal decriminalized in the 90s, Spain decriminalized, it just, why would we not enable at least compassionate access for this? I was at this round table with therapists and law profs and people who understand the steps we will need to take to enable this to become a medicine in the UK with our specific demographics and laws. And actually Transform Drug Policy Foundation have written the blueprint for state regulation of all drugs, including psychedelics. And that is an organization full of experts. So the blueprints are there. We just need to kind of, and it will be hard work, but I envisage that the pharmacy profession will be heavily involved in this, the medical profession, psychiatrists. We need careful regulation. It has to be said that there are people running retreat centers all over the world who probably it's not the safest, and they're not maybe practicing as well as they should be. So say your listeners, if they are going to go on a retreat, they need to be careful and do a lot of research first and get some expert recommendations. That's not to say there aren't some fantastic retreat places. So it will be a lengthy process, but that's frustrating because we just haven't got time. And there is a lot of clinical evidence. What we don't want is what happened with ketamine or cannabis. The government legalizes pretty much overnight, and then NICE will not approve it. There's no NHS access, but you can pay $25,000 a year to get a private prescription. That's just a terrible situation. We're okay to sell it for profit, but we're not prepared to enable people to access it on the NHS. I think that's pretty disgraceful.
Yeah, and I think I think that's really difficult because it really limits the I guess the amount of people that can have access to it, and actually going back to that connection issue again, a lot of those people will need connection and will need support going through that process and things anyway. So it's difficult. It's incredibly challenging, but it could certainly change the shape of the pharmaceutical industry. There are lots of people out there on long-term antidepressants who may well not need those long-term antidepressants anymore if they receive treatment with some of these medications. But that's probably for another conversation. Obviously, you've mentioned Drug Science, which is an absolutely fantastic website. We'll pop a link in that below. And obviously the Heroic Hearts Project UK, which is just another really fascinating project. So I think those two are certainly things that our listeners could really benefit from taking a look at. How do you think people can support the development and the use of some of medications, and obviously where people can learn more? Drug Science is a phenomenal website. Is there anywhere else that you'd like to point people towards?
Yeah, there are a lot of great organizations working on this. I would, for the sort of end of life, I'd go to Therasil, have a look at their website. Saipan
Yeah.
is a fantastic patient network. That's
Right.
there was a chap from Saipan at the event I went to last week. That's, for people who are interested in the patient perspective, I think that's really useful. The Mind
Yeah.
Foundation, they're a German organization that provide an awful lot of really good information. Onaya Science, that's Simon Ruffle, iPhone, and Nige Netzaban. That's their organization, and they provide training for people. You may have listeners who want to become a psychedelic therapist, so
Yeah.
they provide training, as do Drug Science. Actually, quite a lot of organizations now provide training. A friend of mine's done the Onaya course. She said it's really
Yeah.
fantastic. Their focus
Brilliant.
is on kind of indigenous use and
Yeah.
ceremony, but also how you would, the sort of clinical environment. Perea is a European organization. These are all on the Drug Science website
Yeah.
for psychedelic access in Europe. So that's a joint effort by all the European countries. That's pretty
Brilliant.
cool. The Mind is a psychedelic initiative. They provide funding for psychedelic projects. Unlimited Sciences. I'm looking at some of these on the Drug Science website because my memory is so
Yeah.
bad. There's something called OIOC, the Organization for Indigenous Outreach and Conservation. And we did a podcast with ICEERS, a couple of absolutely brilliant human rights lawyers from ICEERS the other day. And they are working with Indigenous people who become criminalized for transporting or medicines that belong to them. So that's shocking. I'm
Yeah.
shocked. It's a brilliant podcast. And they're actually talking about the colonialism that is the drug laws, really, the
Yeah.
use of medicines, opium by Chinese people, cannabis by communities. So the outlawing of that by Western nations,
Yeah.
that's colonialism, outlawing that, but we're prepared to use it as a medicine.
Yeah.
Actually, Julia Buxton, who's a good colleague of mine, she's at Liverpool Uni. She is publishing a book on drug policy in September.
Oh,
Or it's coming out
brilliant.
maybe in October. That's a really. I was just looking at it, sort of proof of it yesterday. It's quite short. It's really, really beautifully written, and
Mm.
it's the sort of the origins of global drug policy and the
Yeah.
implications. And what I learned yesterday was that 70% of countries in the world cannot access opiates for pain relief. It's, that's a real shock. And yet
Yeah.
the law enforcement people are seizing huge, vast amounts of opiates kind of on a
Yeah.
daily basis, that is
Yeah.
being sort of trafficked. It's just, there's so many contradictions and things that things that are unjust and do not make any sense with the
Yeah.
drug laws. The ICEERs, that's lovely. And the colonialism there, that really made me think actually about how we're using these medicines in the West. And they said, well, how about you don't actually send people to war? You maybe completely, people should behave a lot better and maybe don't need that healing. Anyway, I
Yeah.
thought it was a really, really interesting, really good perspective.
Yeah.
We talked about Johann Hari. His book, Chasing the Scream, is
Amazing book.
absolutely one of the
Yeah.
amazing book. One of the first ones I read when I was started to work on this. So for people who want to understand the injustice of the drug laws, how they came about, the addiction, the relationship between trauma and addiction, and how we treat people who use drugs, the shocking way
Yeah.
we treat people. And that's a beautiful, beautiful book. Actually, I'm a big fan of Alistair Campbell and Rory Stewart's podcast, and they were asked, obviously a big fan of your podcast as well, Angela, but they were asked
Mhm.
if there's something that changed your mind. And Alistair Campbell said that book changed his mind about the war on drugs and our drug laws. I thought, oh, well, that's very, very
Yeah,
interesting.
it's a good indicator, isn't it? I think the Johann Hari's book, Chasing the Scream, should be read by anybody who loves or supports somebody who has struggled with any drug or alcohol misuse,
Yeah.
because it gives a very interesting and new and awakening perspective on the area. And I think it can almost help you develop a degree of understanding and compassion. Horrendously uncomfortable in parts, but really, needed.
Yeah.
Jo,
Yeah.
thank
Yeah.
you.
It's brilliantly done. And of course, anybody wanting to learn about psychedelics, I think Michael Pollan's book, How to Change Your
Yeah,
Mind, it's also a Netflix series. That's fantastic. That's one of the ones that I started with. loads of podcasts. I mean, the drug science podcasts are amazing, but you mentioned that Joe Rogan episode. I really enjoyed that as well. That was really interesting to hear those two. One and a Republican politician as well, which quite interesting. Talk about iboga and how transformational that experience was. I should say, just for people before we finish, that these drugs do have an impact on the cardiovascular system. So you will get an increase in blood pressure and heart rate on taking any of the psychedelics. And for people long-term microdosing, they do have an interaction with the heart valves. And there hasn't really been much research done on that. So that's sort of something to just be aware of.
Yeah.
I don't think it's an issue if you're going to take, if you're in a situation where you're in a retreat and you're having a couple of high doses, or you're in a clinical trial. But if you're microdosing for a long time, I think it's worth having a think about that. Maybe getting an ECG done just to make sure that you're not having any, if you've got cardiovascular history, it's worth talking it through with a GP that you can sort of trust, I think.
Yeah. Jo, this has been an absolutely fascinating conversation this morning. It's been really, really good. I think every time I come away from a conversation with you, I come away with a load more questions as well, which is great. And hopefully you maybe one day will come and join us again on the podcast. It would be absolutely fantastic to have you back. But thank you so much for all your wisdom imparted this morning. It's absolutely fantastic. If people have any questions, then perhaps they can drop them below and we can get back to you. But thank you again so much. Everything that you're doing in this field is very much appreciated, and hopefully looking forward to some progress. Potentially later on in the year, there might be an event going on to discuss this further in Plymouth, and we will let you know more about that later on the website. It will also be announced on social media. Thank you. Jo, are there any specific events that you think that might be of interest to people other than the one that we're planning for sort of the later on in the year in Plymouth?
Well, I am organising an event in Manchester at the university. It's 2nd of July, 2 to 6 p.m. £5 a ticket. It's psychedelics for trauma in elite athletes, and we'll be looking at TBI, traumatic brain injury, and the psychological trauma that comes from having been an elite athlete, maybe being injured and having to give that up. So we have David Nutt doing the science of psychedelics. Excellent. We have Grace Blessed Hopley talking about the science of traumatic brain injury. We have Nige Netzaban talking about a study that they're doing in the Amazon, Peru, with ayahuasca for TBI. We have got Sarah Tai talking about the psychological impact of trauma and the therapy, how important the therapy is. We have got Rory Lamont, who was a former professional rugby player up in Scotland, talking about his trauma and his healing experience with iboga. That's a brilliant story. And we've got Daniel Carcillo, a former ice hockey professional who had bad TBI, a diagnosis of dementia, and has had a significant experience with a few different psychedelics, and has kind of restored a lot of his function. And McCall, an MMA fighter, they're both going to be zoomed in. Going to be probably serving Sentia afterwards, and there'll be loads of opportunity for people to network and learn as much as they can about psychedelics from the experts.
And for £5, so how do people book into that then?
It is being advertised on the Drug Science website. The Eventbrite is all on the Drug Science website for now. I'm also organising a much smaller event in Swanage, which is where I live, Swanage in Dorset, in the Molam Theatre. And that is Psychedelics for PTSD on the 11th of June. Swanage is not very easy to get to. I'm going to speak about the science. Keith Abraham from Heroic Hearts UK is going to talk about his healing experience with ayahuasca. And we've got a brilliant and beautiful psychedelic therapist, Siri, who's going to be speaking about the therapy.
Brilliant. I'm looking forward to that. Yeah, I'll be there certainly at that one, and potentially at Manchester. So looking forward to it. Fabulous.
Brilliant.
Yeah, brilliant.